Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And today's guest is Joanne Mizell. She's Chief Operating Officer at Banner Aetna. Welcome, Joanne.
Thank you. Thanks for having me, John.
Yeah, excited to dive into a really interesting project you're working on, which I think is really important in the theme of revenue, which is one of our top themes at Healthcare IT Today. But before we get there, tell us a little bit about yourself and Banner Aetna.
Sure. Joanne Mizell, I'm Chief Operating Officer, Banner Aetna. Been in the industry 30 plus years. I won't go beyond that. And kind of had an opportunity to view it from a lot of different angles. And Banner Aetna is a joint venture between Aetna Health Insurance and Banner Health, a very large health system in Arizona. And the new word is payvider, and I guess that's what we are, right? And we are here trying to fix healthcare and the member experience in Arizona.
Yeah. Well, it's interesting you talk about that payvider. I think it's such an interesting concept that's, I actually heard this maybe a decade ago. They said, hey, eventually providers and payers are going to be the same. And at the time it was groundbreaking. Now it's just kind of become reality. But let's talk about some of the things that you see when it comes to the financial and revenue pressures that healthcare organizations are really facing today, because that is one of the biggest, hottest topics on our site.
So I think that technology and medical advances over the decades I've been in the industry have been positive. They've really improved from a health standpoint, mortality rates. They have increased life expectancy quite a bit. And, we've all seen it in our own lives where people, it's not unusual to live to be 90 with 20 different chronic, horrible conditions because we have new technology and medications and things like that. I think what that also brings, though, is for those individuals that take advantage of that and extend their life expectancy and extend their quality of life is a high cost, right? New technology is really expensive. And with as a payer and a provider of health insurance, our premiums are healthcare costs plus expenses, right? And when the expenses are going up at the rate they are because of this technology, it puts pressure on premiums, which our members and our customers are very sensitive to, right? We don't, we can't have 20-30% increases a year, even though the expenses are going up. So that's a pressure that we're always dealing with that's really related to the technology. And then just from an administrative standpoint, the technology can help. It can reduce some expenses, but then it also creates complexity for members as well. So we have that balance to really, feel real, to be, humans and interact with our members as people, and not just make it all around technology. But it's tough to take advantage of all the technological and medical advancements and not have it impact premiums. And that's just really a challenge.
Yeah. I think it's always interesting in healthcare. For example, in most businesses, you're like, well, let's just increase revenue. And in healthcare, we're like, no, we don't want to increase revenue. That means there's more services, right? And it's kind of the same thing. Like, oh, well, why don't we just reduce costs? Well, it's like, no, that means we want to shorten their life. No, that's not a tenable, we like that they're living longer. It just makes for interesting revenue challenges, right? But how does it, for Banner Aetna being a payvider, as you kind of introduced, how does that allow you to address some of these problems that would be maybe harder to address if you didn't have a foot on both sides of the aisle and as a provider and a payer?
it's all my most of my decades in the industry have not been in this payvider
Mhm.
environment. So this has been the last 5 years, and it's a game changer. Actually, I mean, I can literally say that being able to collaborate and have these conversations with the health system about how you provide what you need for the members and to improve their health and their lives, as opposed to it being two sides of a table doing a negotiation around
Mhm.
pricing and having it all about that. It just changes everything, and it really helps us to create how together can we make things better for our members and the health system's patients, which are, they're the same person, right?
Yeah.
And sometimes they're a patient, sometimes they're a member, but it's having that, you know, being on the same page with our goals together, and without that adversarial negotiation and relationship, just changes everything and makes it so much smoother. And it's, for me, it's so much more rewarding as well to work with someone that you're not fighting with all the time to make things happen. You're trying to do the same thing, and it's never easy, but everybody's working on it together.
Yeah, it sounds like it created alignment. That's
Absolutely.
versus adversarial. What a fascinating
Absolutely. Yeah,
view.
financially as well as just ethically, and viewing that consumer of healthcare the same. So alignment in a lot of ways.
Yeah. So talk to me about your frictionless billing program, right? That you've been working on, kind of what prompted this effort, what went into it, what have been some of the results?
Sure. So frictionless billing, we're constantly looking at ways that we can improve things for our members and make their lives easier in accessing care, in understanding their plan, in doing the right things for themselves and their family, from understanding what their options are. And one of the big detractors from an NPS kind of standpoint is members. They're getting a bill from their health system after they receive their services. They're getting an explanation of benefits from their payer, and they're expected to take those two and reconcile them. And it's not always simple, especially when you're getting very complex care, to do that from multiple providers and so forth. And so, one of the things that we set out to do really early in the joint venture was find a way to address this.
Hmm.
And we started working with a lot of vendors and found some that were just getting into this, that dealt with rev cycle and how to make those connections, and nobody was very far along. So because of this joint venture relationship and the alignment, as you mentioned earlier, we stepped back and we just said, why don't we just do it together? Why don't we build it
Hmm.
together?
Okay.
And that is something you can't do if you're not aligned to the extent that we are. Even as an ACO, I don't think we could have done it. But
Mhm.
everything was open, and there was a lot of transparency from both sides about how we do things, what the pricing is, what the costs are, what the negotiated rates are. And what we created was what we call a frictionless bill, and it's essentially a single statement that integrates both the bill and the explanation of benefits, that's
Wow.
coming from the payer and the provider, and saying, okay, here's your statement, and this is your single source of truth, and you don't have to reconcile it. And if you do have a question about it, we have a dedicated toll-free number for you to call, and we'll help you through it and trying to make it easier for those members. So that actually, it was a really, really long process, took a lot of
Sure.
IT work on Banner's part, on Aetna's part, and from ours as well, to connect everything and to make sure that they align properly. Um, but at this point, I can't say people are calling us and saying, this is the most wonderful thing ever, because
I don't know
no one,
anyone excited to get a
no,
bill. No.
no one, that's right. That's right. No,
That's
no one's
fair.
excited to get a bill. But I think that, we've had such low traffic on that toll-free number with questions about it. People are understanding it, and it's doing one of the things that we wanted to do was simplify it for the process for members. So that was our phase one. We're moving on to phase two, and enhancing that with some assistance with prior authorization and
Okay.
just more transparency around from prior auth appointments, services, and bill.
Interesting. Yeah, it reminds me when I quit the day job to do this media full time, I had to go get insurance, and the guy's like, "Well, we only pay on EOBs. We don't pay on bills." And I was like, "What?" It was like my first education of exactly what you described. I was like, "Oh yeah." And then, of course, I've been through a few childbirths with multiple doctors, and you're right, it's miserable. So that's awesome that you have improved it so much for people and consolidated those two. Again, it goes back to the alignment though that
Mhm.
allowed that to happen, because it wouldn't happen otherwise, I think, right?
I don't see how it could. I mean, you might be able to kind of staple something together and
Sure.
do that, but to really do it in where we're telling that member both of our logos, both of
Hmm.
our saying this stamp of this is it. So if you pay this that you got it right. So
Yeah.
yeah, it's exciting for us. So we're excited about it, and we're excited to build it out more.
Well, and how important has that become, right? I mean, I've had this many people on the program before talking about the shift of, the patient experience when it comes to billing, because patient collections has become so important and all that. So it sounds like you're in line with that trend as well, which is pretty awesome. So,
Yes.
you've had, decades of experience in the industry, as you kind of talked about. I'd love to hear, in this time, working in the industry, how have you seen where technology has maybe helped, and maybe some places that, it hurts us compared to when you first started?
hmm I, you know, it, I think it's helped more than it's hurt. Just
Hmm.
over, if I think about when this question over the years and decades, I think it's helped more than it's hurt, because healthcare and paying for healthcare has become so complex,
Mm.
that the technology does help a lot. Back when I started, and the first PPOs came out, you remember
Hmm.
uh,
Yep.
PPOs the first time you heard of them? When they first came out, I mean, they were looking in books and handwriting on it what the negotiated rate is, and someone else was going to cut the check. It was pretty archaic, and that certainly technology simplified that, loading those things and creating that automation, and with that, the costs of having someone hand do everything has decreased. So the expense portion, I think, of what we pay for health insurance has definitely benefited from that. But where we've, I think, where we've really tried to simplify with technology, at the same time, it makes things more complicated for members, because you have portals, you have apps, you have
Yeah.
the way that the health systems, and you're trying to find providers online, and then you're using an app to make an appointment, and then you need to check in, and they're sending you things, and you got HIPAA, and you got disclosures, and you got all this other stuff coming at you, and I think it's a little confusing for members. And that's when I mentioned earlier, I think that's why we really need to have the human touch there for them still.
Hmm.
And I know there's a lot of let's take the human out of it and do everything digitally, but people need to be walked through sometimes the complexity of healthcare and connecting all the dots. And that's still something I think that's important, and I hope that the industry is going to start going back that way a little bit more, and leveraging the technology and that human touch.
Yeah. My mom would appreciate you saying that. I was hanging out with her this weekend and she's like, well, why can't they just call me and tell me the lab result? Why do I have to log into some website portal,
Yeah.
something or other that I don't know about? And when I get the info, I don't know what it means. Can't you just call me? I was like, well, mom, if it's abnormal, they will call you. She said, oh, well, that's some relief. She's like, but how do I know that they've checked it? I was like, yes, that's right.
Right. Yeah.
It's a balance.
Yeah, and it is. But I do think that from what I've seen, technology in healthcare and in our business is so much has made things easier. It's been getting things quicker to market and quicker to patients. So I think overall it's been when you net it out, it's been a positive.
Well, and I think what you described as I was listening to you is that we got more ambitious because technology allows us to do things that,
Yeah.
like in the paper world, we couldn't create a portal for patients to be able to access their bill or their record or whatever it might be. But now we can, but that's complicated things in other ways, right?
Right. Because
So,
then it may create more questions, right? When someone's going into their portal and they see, there's so much information, which is great, but it's distilling that information and finding what exactly you're looking for, and sometimes it can be overload.
well, AI will solve that, but I'm just kidding. No, that's a topic for another day.
Maybe.
It'll help, right? Well, as we wrap up, we always like to end with some kind of career type focused subject to kind of finish off the episode of the podcast. So tell us, what was the best piece of advice that you'd give someone who is maybe just coming up in the industry?
I would advise them to really be a student of the industry and listen to podcasts like this. Really, outside of the world that they work in, know what's going on and pay attention beyond your scope. And because it just changes so fast, and you could be completely left out if you're siloed in the company you're working for and the work that they do and not see how it connects with everything else. So I think, the advent of the podcasts and the folks that you can get good advice and insight and information from, different ways of looking at things, I'd highly recommend paying attention to that, or you're going to get left behind pretty quickly.
Yeah. And this wasn't even a paid promotion of podcasts. So thanks, Joanne. No, but it's good advice, right? Like being educated and keeping the bigger picture, especially in healthcare where it's so intertwined and interrelated, and being able to understand what's happening and what's changing is really good advice.
Thank you.
Yeah.
Thanks.
Well, thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast application. Thanks so much, Joanne.
Thank you.